Have you ever wondered how countries with world-class hospitals, advanced technology, and the best doctors still struggle to keep their people healthy? It sounds impossible, yet it's true. Even in some of the richest nations on Earth, people die waiting for treatment. Doctors are overworked, and healthcare systems collapse under their own weight. So, why does this happen? Let's rewind a bit. When we think of healthcare in rich countries, we imagine clean hospitals, robotic surgeries, and miracle medicines. But behind that shiny surface lies a complex machine, one that often breaks down, not because of a lack of money, but because of how that money is used. The first big problem? Healthcare is built for profit, not for people. In many developed countries, healthcare works like a business. Hospitals compete, insurance companies chase profits, and pharmaceutical companies price medicines higher than gold. The more tests and treatments are done, the more money flows, whether the patient truly needs them or not. This means the system rewards quantity, not quality. It's not about keeping people healthy. It's about keeping the system running. Take the United States. It spends more on healthcare per person than any other country in the world. Yet millions of people skip treatment because they can't afford it. Meanwhile, doctors drown in paperwork and patients in debt. It's not a system of healing anymore. It's an economy of sickness. The second reason? Inequality. Even in rich countries, access to healthcare isn't equal. Where you live, how much you earn, or even your job can decide how long you live. In big cities, hospitals may have advanced equipment and specialists. But in rural areas, people travel hours just to find a doctor. So while some patients get cutting-edge treatment, others die from preventable diseases. And then comes bureaucracy, endless layers of paperwork, insurance claims, approvals, and red tape. It slows everything down. Doctors spend hours filling forms instead of treating patients. Nurses juggle reports instead of people. And the system keeps getting more complicated every year, like a giant maze with no exit. But maybe the most invisible reason health systems fail is because they focus on treating sickness, not preventing it. Governments spend billions on hospitals and surgeries, but far less on mental health, nutrition, and education. We wait for people to get sick, then rush to fix them. It's like mopping the floor while the tap is still running. Even advanced nations forget that the foundation of health isn't medicine. It's lifestyle, awareness, and prevention. When we ignore that, no amount of money can save us. Now, let's talk about something deeper, the human factor. Doctors, nurses, and healthcare workers form the heart of any system. But today, many are burnt out, underpaid, and emotionally exhausted. The pandemic showed us this painfully well. Empty applause at balconies couldn't heal those who spent sleepless nights in ICUs. When the healers break, the whole system breaks. So if throwing more money or technology doesn't fix it, what will? Experts say real reform begins when we stop treating health as a product and start treating it as a right. That means stronger public health, transparent systems, and equal access for everyone. It also means shifting focus from hospitals to homes, teaching people to stay healthy, not just how to recover. From mental wellness to clean food, from affordable care to trust. These are the real medicines society needs. Some countries are already trying. In Denmark and Japan, preventive care is prioritized, regular health checkups, community wellness programs, and digital systems that connect patients directly with doctors. These models show that when the system works with people, not on them, health becomes sustainable. So next time you hear about a broken health system, remember, it's not just about hospitals or doctors. It's about values. Do we see health as a business or as a basic human right? Because in the end, the true measure of a nation's wealth is not in its skyscrapers or its GDP, but in the health and happiness of its people.